Did you know that a simple test can reveal the health of your immune system, detect infection, and even provide you early warning signs for serious medical problems? In this video, I'll walk you through CBC Test, and I will be creating a series of videos regarding common tests and procedures so that you could understand them with confidence and interpret for yourself and for peace of mind. Hello. My name is Dr. Kulmeet and welcome to Kundlas MD, dedicated to simplifying healthcare. Today we'll be discussing CBC test with differential. What is CBC? Whenever you get a blood test, CBC usually is the first test which gets reported, and it has multiple numbers and indices, and it is very mind-boggling to interpret. I will simplify this CBC test with the analogy of a battlefield. Your blood is like a liquid army. And this army has three kinds of cells, which are called white blood cells, red blood cells, and platelets. Your white blood cells is the army, red blood cells is your supply chain, and platelets are like medics. For this army to work effectively and efficiently, you need a stronger army, good reinforcement, and proper medics. CBC, as I alluded, is made up of different kind of cells, and these cell levels fluctuate within range, and most of the time these fluctuations could be physiological or pathological. And I want to empower you when to be paying attention, when not to be so anxious and worried about these test results. WBCs, as I alluded, is your army. This army has 5 units, and the first unit is your neutrophils. Neutrophils are your infantry or your first line of defense. They get to the scene immediately, and when they get there, they recruit more army units so that they could neutralize any kind of bacteria, viruses, parasites to lesser extent, and fungi. And if there is any kind of autoimmune diseases where our immune system start working against us. This infantry unit makes about 60% of total white cell count. I want you to pay attention to normal values for each of these tests, whether it's a total white cell count or different kind of cells which are describing, because each lab has a different normal range. These cells or the neutrophils are very powerful. Second kind of WBCs is your intelligence units or lymphocytes. There are three kinds of lymphocytes: T lymphocytes, B lymphocytes, and NK cells. T lymphocytes are the one which primarily identify the threats and coordinate attack. B lymphocytes create powerful weapons like antibodies or your missile system. The NK cells are the commando units of the intelligence wing. If they see any infected cell or abnormal cell of your own, whether early cancer cells or any kind of a change which they recognize as threat, they will eliminate and neutralize this. Third kind of cells are called monocytes. They are the heavy artillery. When they release from the bone marrow, these kind of cells, they are bigger in size. They have a lot more chemicals in them. They circulate and reach the site of inflammation or infection. They get transferred into macrophages, and they are like heavy tanks which neutralize the debris left from previous war, and they kill everything what is left. Fourth unit of your army is your eosinophils or the air force. They are the precision bombers. They attack parasites and also dangerous allergens. Fifth unit is the alarm system of your army, which is the basophils. They recognize the intruders and they release stronger chemicals like histamines, which creates an alarm system and recruit all other divisions of your army. So your white cell count is the analogy of army as 5 units, neutrophils being in the infantry, intelligence unit is lymphocytes, precision bombers are your eosinophils, alarm system is your basophils, and heavy artillery is your monocytes or macrophages. Next series of tests which you will see on CBC is RBCs or red blood cells. Red blood cells have multiple indices which I will describe. Primarily red blood cell has hemoglobin. Hemoglobin is the one which carries oxygen from your lungs and bring carbon dioxide back. They are the delivery truck or the supply chain of this imagined army. If you don't have fuel or the oxygen, nobody can work, nobody can fight. So how much hemoglobin we have is very, very important. Normally, hemoglobin is slightly different in male and females. Males have a little bit higher hemoglobin than females. And I want you to pay attention to the normal values of each lab. And I'm refraining from giving you general guidelines, but the values, because it can differ from lab to lab, but within a normal parameter. So you pay attention to the normal values. If your hemoglobin goes higher than normal, we call polycythemia, and multiple reason your hemoglobin can increase. Many times it could be physiological if you live in a high altitude or there is increased demand. But number one reason for high hemoglobin count is smoking, because smoking continuously stimulates your red blood cell to produce more and more because your oxygen capacity is going down and your body has to compensate by increasing hemoglobin. Then on CBC, when you are looking at your hemoglobin, there are 4 or 5 other indices. One is the PCV, which is packed cell volume, which means how much is the volume of the blood or red blood cell which is circulating. Next is MCV, MCH, MCHC. Those means what is the size of the cell, how much hemoglobin volume is in each cell, and what is the concentration in comparison to the cell. These indices give us information about your iron load, B12 level, folic acid level, and other chemical problems which could be arising in this system. But whenever at home you are trying to understand your CBC and especially hemoglobin, pay attention to the normal range of hemoglobin. And if there is a problem, I'm very sure your physician will discuss with you. Third is your platelets, which are the medics. Whenever there is a cut and bruise, these platelets become sticky, they stick and plug, and then they recruit clotting factors to plug up and make a clot. These are the one which stops bleeding. Normally, every day we make a lot of blood clots and a lot of bleeding and trauma happen to the body. These are the unsung heroes or the medics which go and plug this one. In our imaginary analogy of army, the army is made up of white blood cells, which are of 5 different kinds. Then the supply chain is your hemoglobin, which is the lifeline. And third is the medics or the platelets. Pay attention to the normal range for each lab. And whenever you see any abnormality, whether it's on different kind of white cell counts or hemoglobin or your platelet, do not panic. They could be physiological, could be easily explained, but you must not ignore. Whenever you see any abnormalities, you must discuss with your physician and they will go over the changes, whether they are acceptable or not acceptable, and what needs to be done, how to be followed. I hope my analogy of this battlefield and liquid army and liquid senses, what CBC will help you to make better sense of this very confounding topic. Thank you very much. I will see you in next videos. As I mentioned, we'll be creating a lot of videos in this series, and you will be able to understand common blood tests for yourself. Thank you.